Hello, everybody,
Hi.
and hello, Dr. Amit.
Hi.
Welcome, and really thankful for you to be a part of this conversation that we would be having for the new babies. Thank you so much for accepting this invitation, and with these conversations, certainly it would really guide a lot of new parents as well as clear up a lot of their myths that they carry from generations to generations. Um, so
Definitely.
to introduce all of us, today we have Dr. Amit Gavde with us. Dr. Amit is a consultant pediatrician as well as a neonatologist from Motherhood Hospital, and he has a lot of experience with him, and he's been working with many babies. We were just discussing this that babies are nothing but a bundle of joy. They when they come either to the hospital or wherever we meet them, we really see them, lighting up the room, bringing in so much of laughter and so much of creative energy around them. So very excited to bring a series of conversations. So this conversation is brought to you by two brands. One is R for Rabbit, as well as Motherhood Hospitals. And a quick introduction to myself. I'm Neetu Lekhi. So, doctor, would you like to add on anything over here?
Thank you so much for me having here, and I feel very lucky that I'm being a part of this podcast and will help parents to guide about the care of the newborn baby from like birth till 6 months or beyond that also. We are always ready to do that.
So, doctor, there is one, we hear so many things, when a baby is born, there are so many advices, so much added on.
Yeah.
So, can you share some things which is actually a myth and which is not a myth?
So babies being born at every home, like all the newly married couples, and they're getting much more advices from their grandparents, parents also. That thing in that way they are always right because they have seen those babies. They have seen those grandparents, parents also are taking care of those babies. But there should be some scientific approach for any illness or regarding the care of the baby, and they should go through proper scientific channel to take care of their baby so that there should not be any harm to the baby. So I will advise every time, if you want, if the baby is having any illness or if they are having any other doubts also regarding baby care, they should approach to a child specialist. We call it like a pediatrician.
Okay.
So there are many myths. So commonly myths is like first of all, they try to put kajal, the black thing in the eyes of the newly born babies. So that initial days, those used to put as a part of ritual. Some nowadays also they follow. But if you are asking any pediatrician whether this is allowed, this should be done or not, so many pediatrician, most of the pediatrician will tell no to this because it can cause an allergic reaction in eyes that can cause a conjunctivitis, and later on we never know, it can cause a blindness, can affect any part of the eye also. So it is strictly not recommended to use kajal in eyes. They should put as a part of ritual, as a part of tika, or a small dot like thing below the chin as a part of their ritual, but not into the eyes. And same with regarding to the powders also. So talcum powder, they used to many parents thinks that if they are putting powder, the baby will feel like baby will get a good smell and baby will look bright, but in fact it is harming the baby because that can cause a chemical pneumonia in the medical word, and which is very troublesome and can land up the baby in ICU also. So avoid kajal and powder during the initial stages of the development of baby.
Oh, wow. So, doctor, what about the fun aspect now? This is such a cute age.
Yes.
How do you start, enjoying with the baby, and what's the fun aspect of the baby?
So fun aspect of the baby is always a single day, single minute with the baby is a bundle of joy, as we described earlier in the introduction part. So suppose if you are considering a baby who born newly, so by a initial look of baby itself gives satisfaction to the mother and the parents involved in the care also. So it relieves the anxiety of mother, and it illuminates whole room as we described earlier also, and it gives a joy to the parents that now their main role starts from here. So the initial steps like taking care means feeding the baby, involving in the care, changing the diapers, and setting their routine, like feeding the baby, changing diapers, that we describe. Apart from that, there are many things they should consider. They should learn, relearn. There are many things because they are getting many advices from the grandparents also. So they have to learn and relearn many things from a person who is involved scientifically in the care of baby, like a child specialist.
So, doctor, there are so many fun facts that we hear. Like,
Yes.
for example, a mother or a father, they keep fighting that, oh, he looks like me, he looks like me. Can you share some really cute fun facts about infants?
Yeah, definitely. So this is a very common question asked by many parents, or they discuss among themselves about like the baby's face is looking, eyes are like me, hairs are like you, like that. But basically, it's a genetic material which baby has received from both the parents. So most of the time, it is both. It's a combination of both. So the final appearance, so sometimes baby get a facial appearance of mother but eyes looks like father, so because it's just a combination of the genetic material. And one more thing to add, that the shape of head, many parents they ask that one side of the head is very flat, so the skull bones, those are in the developing stage, and the final head shape the baby will receive by the age of 2 years. So till that years, till the baby achieve 2 years of age, the parents have to sleep the baby on either side. They have to change the position every 6 hourly, so that the final shape of head will be like a rounded, and all related to facial appearance and shape of head and the eyes. This is all a genetic reconstitution, and it all depends on mother and father both. So it will it will never be like a single parent. The baby looks like a single parent. It's a combination of both. You can see many features overlapping for them.
Any other interesting fun facts of the baby?
So one of the interesting fun fact is about regarding feeding the baby. So parents has to learn about what are the feeding cues of the baby. So sometimes baby make funny faces. Baby can turn angle of mouth to one side. Baby can take tongue out also. Sometimes baby do lip smacking also. Sometimes, but it's in the normal way. So these are all feeding cues, and this is a new thing for newly born baby and for the parents also. So, like, we can consider it as a fun fact. Okay. So that's one.
So, doctor, what are the products that mothers should ditch, and what are the products that mothers should actually invest in?
Yeah. So first of all, I would like to answer about what product mother should buy or we should include in our baby routine care. So most important is a diaper. What I will suggest, diaper followed by baby wipes. Basically, it should be a water base. It will be beneficial for baby so that it will be a less irritant. It should be fragrant free, and after that, baby should have a baby massage oil. According to the scientific recommendations, it is basically we should go ahead with the coconut oil. There are many oils available, but we should go ahead with the coconut oil. And followed by that, there should be a crib if possible for baby crib for initial 3 months. And followed by that, for a developmental supportive care of baby, there should be some black and white placards or a gentle noise making sounds.
The placards are good for 60 to 90 days too.
Yes, for initial vision development,
And so,
as we
60
discussed.
to 90 days, what else can they include? Because
For-
most of these, any which way, we would be looking
Yes,
at
from the
purchasing from the day one.
then from 3 months onward, like 60 to 90 days, what we consider they can buy for a bright colored toys also. So that helps in their visual stimulation. And after that, the diapers, these are going to be a part of their routine care. Then a feeding bottle. Initially, if mother is doing feeding, but later on the amount of milk baby requires will be a more quantity. So they should have bottles, feeding bottles. I will advise them to have 3 to 4 bottles each time available at a time, so that they can use for expressing the milk, storing the milk, and one should be ready.
Okay.
So these are the common products I would like to include for 60 to 90 days old baby. The mother should have products to ditch at this age. I will suggest that they should not be giving any gripe water and kutti. That's what we discussed first, and it should not be given basically. And the second product will be a kajal and a powder for this as a part of skincare. They should not use that. And the third one will be they should not be using a very harsh soap like with alkaline pH. Means the soap or a baby care or a skin care product should be a neutral or a mild acidic. So they should be very much careful about these things, that they should not include this which is harming their skin, baby skin.
So, what about feeding, doctor? When should a mother start external food for the baby?
So external food in a medical thing, like we call it as like a weaning diet, a complementary feeding, complement. So mother has to complement her breastfeed. So at this, so usually the complementary feeding we start by the age of 6 months. At this age, baby is able to sit with support, holding the neck properly, and the baby can be sit in high chair also at this age. So this is the age where we advise parents to start with the complementary feed along with the breastfeed. Mother has to breastfeed the baby. So as a WHO says, exclusive breastfeeding is up to 6 months. Beyond 6 months till 2 years, mother can breastfeed, should breastfeed, basically along with the complementary feed. Yeah.
And what are the initial foods that they can begin with?
So initial, what we advise, like they can start with the dal water. It should be in very thin puree form, and the initial food, the consistency should be such that it should be very thin and it should drip easily from the spoon. And we advise for initial 1 week, they can give 3 times a meal, which includes these purees or a dal water, specifically a moong dal water, or some tradition they can follow. Later on, they can increase the quantity. They can start giving homemade Cerelacs, or we advise fruit purees. And later on, like a product or a homemade Cerelac, they can continue. Later on months, they can increase the thickness. They can make it a very lumpy mashy, depending on the appearance of teething. That we can do.
And doctor, when it comes to breastfeeding, many mothers get back to work.
Yes.
So, do you recommend them to have, a formula milk for the babies, or it's better that they use breast pumps?
Yeah, so it's better they use breast pump, and they can express the milk. And the mother milk, they can store in refrigerator at 2 to 8 degree for 4 to 6 hours also. So once they leave for the office, a caretaker at home can give that milk also. If the amount of milk or a baby's hunger is much more, sometimes SOS they can use a formula feed, which will be a stage 2 formula or stage 3 formula.
So, doctor, another very common problem that babies face is rashes.
Yeah.
So, could you guide us something how to avoid rashes?
Okay, so first of all, by looking at any rash, we should know the associated symptoms with the rash. So whether that rash is because of the clothes that baby is wearing, the most common rash will be a diaper rash, and which can include in our like routine bum care, what we take for the baby's routine bum care. So if you find any rash near the bum, so because as it is the most moist area which get easily infected with many bacteria, so we have to gently handle that part. So whenever we notice that baby has passed urine or any feces, we should immediately remove the diaper. First of all, we should clean it with the water wipes or alcohol based wipe if not available. After that, we have to pat that area with a dry cloth, so that that area basically should be very dry. After that, it depends on the severity of rash. If it is a severe rash and baby is getting very troublesome while passing motion and all, then we'll have to apply a medicated creams, which includes mostly a zinc oxide, or a better one will be a petroleum jelly also. Yeah. And there are many other products in diapers also available, or in napkins, baby napkins. And there is one more like a super absorbent napkins or a baby pads. So those will also be helpful in taking care of the diaper rash. And apart from other body rashes, which can be associated with many symptoms, such as like a flu and or a dengue also sometimes. So we have to be very careful. If it is not a routine rash, then they should immediately consult with their pediatrician regarding the.
How would they know it's a routine and a non-routine?
So if it is a diaper rash which they have been educated by their pediatricians at the time of routine visits, and they are found that it's not a usual rash, and it start appearing and it starts spreading all over the body, then they should consult.
Okay.
Yeah.
Right. And doctor, now there's the mosquitoes. So how can you
Yeah.
help the babies?
So for like 60 to 90 days old baby, most of the parents takes them out sometimes. Like they are now more confident that they have vaccinated the baby and they are ready to move out like in the past and all. So what we advise, they should avoid the peak hours of mosquitoes, mostly specifically in the evening, and they should avoid very crowded place and a very dark place where the mosquitoes can attack the baby. So that's the first time. That's the first thing, that they should avoid the peak hours of mosquitoes. Second thing, they should always wear the baby a full sleeves clothes.
Okay.
Yeah. So rather than, there are many products available as a mosquito repellent, gel, sprays, but these are very basic care. Avoid the peak hours of mosquito time and full sleeves clothes if they are having the baby out for the part time or not. And the third thing is, we can apply a mosquito repellent or a gel. Those are available, but they should apply that on clothes of the baby, not on the baby directly.
Okay.
Yeah.
And but is that safe for the baby, doctor? Because they have heavy chemicals, and they say that
Yeah, we
breathing
should.
it.
Yeah.
So as
So
much as
basically, as much as
possible,
possible, try to avoid.
avoid.
Yeah.
Okay. And
And most important, whenever baby is at home, they should use mosquito repellent net.
okay.
Yeah.
Okay. And what about cold and cough? There's a lot of advertising going about using cold and cough rubs.
Yeah.
Are they safe for the baby?
Those are not recommended ones, but basically those are not that much harmful also.
Okay.
So not a clear-cut recommendation to use baby rubs for the cold and cough. They can easily consult. They can take a prior basic precautions, like there are many nasal mucus extractor also.
Okay.
Most of the pediatrician during their routine visit, they advise them, if the child is found to have nose block or some gurgling sound initial, simply they can use a nasal saline drops, what the pediatrician must have prescribed. Whenever the baby gets sneezing, early cold or a runny nose, they can use a nasal clear or a nasal saline drops, followed by they can take a steam also, but it should be from a distance.
Okay.
So that helps.
R for Rabbit, the amazing baby company.